Hey, good morning to everyone, and a warm welcome to all the guests who are attending this information session on the updated guidance for risk-benefit assessment of food. My name is Magid Yunus. I chair the Scientific Committee Working Group on Risk-Benefit Assessment, and I'm as chair of the Food Additives and Flavoring panel. I am a member of the Scientific Committee of EFSA. Now, this session is actually thought to give you an idea of where we stand with the updating of the risk-benefit assessment guidance document of EFSA. And it is part of the efforts to raise attention to the ongoing public consultation. It is by no means meant to replace the public consultation. So what we would like to do is really keep you up to date about where we stand, where the document is, and just get some feedback from you, some initial feedback from those attending today. But this does not mean that you should not contribute to the public consultation in the usual manner. So please, we can answer questions here, but any suggestions for changes, for updates, for additional information that is needed in the guidance, please submit these through the normal channels of the public consultation. So just some housekeeping rules to start the meeting. So you are automatically connected to the audio broadcast. You can hear everything that's said, but you cannot contribute verbally. So it's really a listen-only mode. The whole event is in English, so please submit any questions you have in English. This you can do via the Q&A chat, which you see on the right panel of your screen. So please do that as we go along. We will attempt to answer as many questions as we can, and we will, of course, need to do some prioritization based on the interest we see in certain subjects during the when you submit your questions. But mind you, we will certainly be able to answer most of the questions consequently. It's also important for you to know that the event is being recorded and that we will be publishing the recordings on the EFSA website after the meeting. And finally, I would like also to raise your attention to the fact that at the end of the meeting, all attendees will receive a link to a survey asking them to evaluate the event and the services provided during that event. So in the bottom part of this slide, you can see the screen that you have with instead of the blue, you see me, and then the Q&A on your right-hand side. The next slide. You will. This is the agenda of today's meeting. So I will be moderating this meeting, and I'm being assisted or actually guided by very competent colleagues from EFSA, Maria Bastaki, who is the scientific officer responsible for this document, Irene Catania, Luisa Ramos, and Hermanos Viveris. And we will start by a presentation on the purpose and the scope of the RBA update by Maria Bastaki, who is from EFSA. Then it should be followed by a risk-benefit integration presentation of the existing approaches, particularly, the DALI and QALY approach that we have as composite metrics, and that will be presented by Martin Poulsen from the Technical University of Denmark. After that, Salomon Sand from the Swedish Food Agency will present some new approaches that have been developed in the meantime. And last but not least, Tony Smith from EFSA, from the communication team, will be presenting us the information on some advice on the communication of risk-benefit assessment outcomes. This is, of course, that's a new feature that is very, very important that we really think is a good innovation. Following the presentation, we will have a 1 hour of a Q&A session. So in that period, I will be reading out questions and I will ask the colleagues to respond. and then we will certainly close the meeting and wrap up. So with that, without further ado, I would like to hand over to the first speaker, that is my colleague Maria Bastaki, who will be talking about the purpose and scope of the RBA guidance document. Thank you.
Thank you very much, Maged, and good morning to all the attendees, and thank you for joining this event. I hope you find it informational and helpful. I will go ahead and get started. Just to remind, for a brief introduction of what is risk-benefit assessment. It is a part of a broader risk-benefit analysis framework, together with risk-benefit management and communication, and by nature it is multidisciplinary. It is applicable not only to human health, but to several different fields. In relation to human health, RBA of foods involves parallel assessment of risks and of benefits, their characterization with respect to intake, and finally, the integration with methods that weigh them one against the other. Next slide, please. RBA is important, and we have to make an important distinction between RBA and the traditional risk-benefit risk assessment. In risk assessment, the purpose is to identify the most sensitive endpoint that leads to a health-based guidance value or a dietary reference value, HBGV or DRV, respectively. In contrast, in RBA, all relevant effects that are possible over the range of potential intakes are evaluated, especially when those HBGVs and DRVs are exceeded or are not met. So a challenge in RBA is converting multiple and often different risks and benefits to a common scale for comparison, especially when these effects affect different populations. And such as we have, for example, fertility affecting pre-adolescent children, or the benefit falling onto middle-aged individuals. One way to handle multiple effects is to rank them according to the dose or intake at which they appear and in order of severity. The overall impact can then be assessed at a specified intake level and for a specific population. Next slide. EFSA's scientific committee published a guidance for the assessment of risks and benefits of foods in 2010. The guidance proposed a stepwise or tiered approach from simple comparisons to more refined assessments up to their integration with composite metrics, such as disability adjusted life years, or DALY for short. This allowed flexibility to the assessors to conclude an assessment swiftly when risks clearly outweigh the benefits or vice versa, based on comparisons of intakes with respective HBGVs and DRVs. More complex scenarios, however, required increasing data needs and different methodologies. Next slide. The trigger for the update of the EFSA guidance was the prospect of a new risk-benefit assessment of fish consumption. In 2021, the European Commission discussed with EFSA the feasibility of a new RBA of fish consumption with respect to the presence of persistent contaminants such as dioxins, dioxin-like compounds, as well as a number of other contaminants of concern, such as PFAS, methylmercury, brominated flame retardants, and so on. The risk assessment of dioxins themselves had just been concluded in 2018 by the contempt panel of EFSA. The scope of the prospective mandate for an RBA of fish was discussed also with the European Commission Working Group on Persistent Organic Pollutants. The complexity of assessing multiple contaminants, different types of fish, and regional diets made it clear at the time that a few interim actions were necessary before proceeding. Specifically, the update of the WHO tests for dioxins and the update of the EFSA guidance of 2010. Next slide. As part of the discussions to define the scope of the RBA of fish, member states provided EFSA with feedback on their experience with the 2010 EFSA guidance. Specifically, they noted that they needed guidance that would help them to go beyond comparisons of exposure to HPGVs or DRVs and beyond reporting a single composite metric. They needed scientifically based advice on how to weigh risks and benefits of combined exposure to contaminants and nutrients. They needed guidance to understand the overall health impact and to translate the RBA output into dietary advice. Next slide. As a result of this feedback, the scientific committee was self-tasked to update its guidance on RBA of foods. The terms of reference were interpreted to include benefits of the whole food or of specific nutrients, whereas for the risks, the scope of the guidance was limited to chemical contaminants and not those of microbiological nature or of environmental aspects of food production. However, the approaches presented in the guidance may be adapted to those aspects if needed. And it is important to make clear that the RBA does not replace safety assessments or health claims that are subject to EU legislation, and this is made clear in the guidance itself. The guidance intends to enable the assessment of multiple contaminants and nutrients and multiple risks and benefits. It aims to propose additional methods and metrics to address higher complexity and to include insights on communication of risks and benefits. Next slide. Altogether, we had 4 lines of input for the update. Besides the feedback from the member states that was just mentioned, the guidance took into consideration aspects identified in 2010 that could be updated. It took also into account experience gathered from applications of RBA since 2010, as they were available in the literature. And last but not least, we collected input from experts in the field through a dedicated scientific colloquium organized for this purpose. Next slide. With respect to the experience gathered in the last 20 years since the last publication of the guidance, there were several pivotal publications that were identified, among which there was a summary of challenges in RBA by Nauta in 2018, a comprehensive review by Thompson in 2021 that included 106 publications of RBA conducted for fish and seafood between 2000 and 2019, and then 2 methodological publications, such as the publication by Sand in 2018 on risk ranking based on dose and severity of effects, and a publication by Bouet in 2022 on a systematic and transparent approach to select components to be included in the RBA. Elements of these publications inform the current update and are incorporated in the updated guidance. Next slide. Similarly, EFSA requested input from the scientific colloquium participants in 3 main areas. First, input from risk managers to understand better their needs when developing dietary advice. Secondly, input from experts on new methodological developments that would help improve the weighing and comparison of risks and benefits. And lastly, input on data sources and new types of data relevant to both positive and adverse health effects that may be incorporated in an RBA. And you can find additional details on the web page of the colloquium and also in the published event report. Next slide. Overall, the scope of the guidance is to assess chemical risks, as mentioned. While microbial risks and environmental aspects are acknowledged as part of health of food production, they're not explicitly addressed in this present update, as they require different assessment methodologies. However, adaptations of the approaches presented in this guidance may be made if needed, and they can be potentially incorporated into a future guidance document. The overall purpose of the guidance is to help develop RBAs that serve the needs of risk managers. Their needs in decision-making and issuing dietary advice in the context of their national and regional needs, such as taking into account local conditions, and available nutrient sources. RBAs may also be conducted to explore healthy diets or impact of food replacement or scoping risks and benefits before introducing a new food or a method or a process, etc. The next slide. This is a brief overview of the updated guidance. It retained key elements from the previous guidance, such as the overall framework and the tiered approach. And it introduced a few revisions or expanded on elements that were already present in the previous guidance to better elaborate and emphasize important aspects of the process. More importantly, several additions were made to provide new elements and options. So the additions include approaches for selection and prioritization of components and health effects, approaches for assessing multiple health effects, proposals for integrating risks and benefits while reflecting complexity, mapping the stages of the RBA process with respective appropriate methods, and also providing a few templates or examples for reporting results. Importantly, it also includes communication recommendations. Next slide. So in the next two slides, I will just emphasize two aspects that we have introduced in the guidance. One aspect that is recognized as a key factor in an RBA, and it's emphasized throughout the guidance, is the need for an iterative process of exchanges with a risk manager, especially when the risk manager requests a risk-benefit assessment from a risk assessor, risk assessment agency, such as EFSA or other national agency. These exchanges are needed in order to consider together new information and data that emerge throughout the process so that the problem formulation is adapted to the feasibility of the request, but it also is based on data availability, new information, timing, and other considerations. And I'd like to note here that while a tiered approach is useful to accommodate different needs, it is not required to start an assessment from the lower tiers if available data, expertise, time, and other resources allow the assessor to proceed with a full integration of risks and benefits. Next slide. A second aspect to be emphasized when conducting an RBA is the reporting and documentation of the approaches followed and the decisions made along the way, such that the interpretation of the outcome of the RBA is made in the relevant context and scope. These refer to the selection and prioritization of food components that would be included in the assessment, as well as the health effects that are to be assessed. It is helpful to distinguish what information is needed for an optimal assessment compared to what is available for a feasible one. In order to clarify that the scope of RBA is focused on specific food components or health effects. These distinctions have to be made. And we believe clarity in these aspects helps with interpretation and also with comparisons of outcomes from different RBAs. Next slide. To summarize, the updated guidance on RBA of foods aims to promote consistency of methodological approaches by mapping the methods to steps of the assessment process, to provide options that can be adapted to increasing complexity, such as multiple food components and health effects, but also to allow flexibility to choose between simpler and more complex assessments. And it also emphasizes transparency in the approaches taken to help interpret the outcome in the relevant context. Ultimately, the updated guidance aims to achieve the much-needed harmonization of RBA approaches. Next slide. With respect to the timeline of the guidance, comments received through the public consultation will be addressed with revisions in the document as needed. It is anticipated the guidance will be adopted by the Scientific Committee by September 2024. Depending on the extent of comments, of course. Upon publication of the guidance, EFSA plans to hold an international workshop open to all stakeholders that are interested in learning about RBA. And further plans include collaboration with member states in developing RBA case studies, and also collaboration with other agencies such as WHO and their efforts. Thank you for your attention. I will now pass the floor to the next speaker, Dr. Morten Poulsen.
Thank you, Maria, and good morning, everyone. My name is Morten Poulsen. My presentation will address the risk and benefit integration using DALIS as a composite metric. I will say that this is not addressed. This is not related to a specific subchapter in the guidance document, but it's more a reflection about how to use DALIS as a composite metric and how to integrate risk and benefits. I will say that. Thank you. I will just say that this about. I think if you could please go back once more. Thank you, and I can say next when I would like to change. I can say that this. I think that this DALIS was also mentioned in the old guidance, and also integration was also mentioned in the old guidance from 2010. But at that time, there was not so much experience in how to use these DALIS. I think due to the increased interest we have in risk-benefit assessment and the many papers that has been published, we now have a much more experience of this. And this is also what we will try to convey in this updated guidance. Yes, please change next. As you can see here, this diagram is taken from the old guidance, and it shows how this integration of the health effect is happening. And what I would like to focus on here is the last comment, this risk-benefit comparison. This is a rather simplistic way, but I think it shows in a rather good way also how the process is, and what this is actually a risk assessment combined with a benefit assessment. Next, please. Also, but this former slides I show, it doesn't say anything about whether this integration should be performed in a qualitatively or in a quantitatively way. I think this about whether it should be done in this way should be formulated in a risk-benefit question that ideally should be made in some kind of collaboration with the risk-benefit with the risk-benefit persons in the food authorities. And this is about this risk-benefit question. Also. If you are going to do it in this way, you can say that if you're going to do it in the quantitative way, you cannot use the threshold values as a reference dose, margin of exposure, or tolerable uptake level. These are not sufficient to quantify health impact. If you're going to use this way, you should either use a common or a composite metric. Please, next. These common metrics, they express only a single dimension, which are also mentioned as single outcome measures. And as that these outcome measures could be a disease incidence or mortality. The limitations of using these common metrics, it's a problem because they do not include information on severity and duration of disease, unless, of course, if it's affecting the same endpoint in the same individuals. Next, please. This is again to show that this was a more, you can say, more updated version of the diagram I showed you last time. And I also emphasize that even though we are talking much about here about how to integrate risk and benefits, much of the work that's done in the risk-benefit assessment is also done in the former boxes. You can see the hazard, the health identification, the health characterization, and the risk characterization. So much of the work is also done here. So, but what I would like to focus on here is the integration. And you can see here that this, compared to the other diagram I showed you, this diagram also includes something about risk incidence, mortality, severity, and so on. So that is what is included in these boxes here, and this is included both for the risk side and the benefit side, and it comes together in the common health metrics. The next, please. You can say, and what we like to say, that these composite metrics like the DALIS, they are integrated measures and they combine the information of the disease into one measure. And in contrast to also compared to this common metrics which I told you about, it also reflects several dimensions of health. One problem with this could be that due to this complexity and due to the more information we need here, they also require more data. And for some of these things that we like to do a risk-benefit data assessment for, we don't have these data. Examples of these composite metrics that could be the willingness to pay, the cost of illness, like DALYs and QALYs and so on. So please, next. In the 2010 risk-benefit guidance, DALY, that was suggested as a composite metric. However, it was also mentioned here that not all dimensions are captured in this. Since then, many of the risk-benefit papers using DALYs has been published, and that's also what I told you in the beginning. So we have now a lot of experience. I think also you can say now that the preferred use of metrics when you're performing a DALYs, that performing risk-benefit assessment, that is a disability-adjusted life years, the DALYs. Please, next. Was something about DALYs. DALYs is a measure of healthy life loss and a measure of health loss compared to an ideal life. So you can say that it's a comparison across diseases and disabilities, and it combined information on incidence, severity, and duration of a health outcome. That is the years lived with a disability, and also this is combined with the years of life lost due to premature death from this endpoint. And you can see there's also this formula. You can say the status is the YLD plus YLL. Please, next. It's just a short diagram to show this, and you can say that this the DALYs, that's the population metrics, and this diagram, it shows that you can say for each person, start with the perfect life and then lives unto a certain age where you could perhaps be caught by a disease, and you live with a disability for some years until you reach a certain point where you die. So this due to this disease. So you can say this DALYs includes both the years you live with this disability, with this disease, and also include the years that you lost due to the premature death. And next, please. DALY, that's calculated for each scenario in the risk-benefit. Often in the risk-benefit assessment, you have scenarios where you like to say a theoretical intervention. That could be an increased fish intake, for example, in a population. And you are calculating these DALYs for each. And there's a difference in the DALYs between this reference scenario, this point where you can say it's like a control group, a control scenario, and one of the more alternative scenarios that gives you information on the overall health gain or loss that comes out of this risk-benefit assessment. And that you can say this equation I have down at the bottom here, you can say this, that the DALYs from the alternative scenarios minus DALYs from the reference scenario, that gives the delta DALY, which are the DALY number you need to go further with. And gives you the information. Please, next. And the DALY outcome that can be expressed for the total population, but for comparison, DALYs are often expressed per 100,000 individuals. So you can compare across country, and you can also compare different other endpoints with this, and compare with other risk-benefit assessment. And it's present the difference in health impact for each alternative scenario compared to the reference scenario. And actually, it illustrates how many healthy life years you could gain each year if the adult population follow the alternative scenario instead of the reference scenario. That could be alternative scenario, for example, eating more fish. That could be an issue here. To assess the significance and magnitude of the observed DALY differences, you could compare with other risk-benefit assessment, risk ranking, and burden of disease estimates if these are quantified in DALYs. Next, please. I would say also the outcome of the DALYs calculation can be reported in a figure or a table. And I would say this, that to capture the whole dimension of a risk-benefit assessment, reporting should also include outcomes like health effect, level of evidence, population affected, number of cases, years of life lost due to this disability, and years of life lost due to the premature death, and so on. And I think what we also talked about is that the member states have some difficulties and understand how to use these tallies. And I think that could, I think that, and also whether this could be used for dietary advices. And I say it's not easy, but I think that it could be done. And I think it's a good help to also to give further dietary advice to the member states and to the population when you follow these outcomes of the risk-benefit guidance. I think that was it. I can see. Next, please. Yes, that was it. And I would like to hand over the floor to my colleague, Dr. Sand from Stockholm.
Oh, thank you. Thank you, Morten. So I will speak about the characterization and integration of risks and benefits using other methods that we also discuss in the guidance. And you can change the slide.
A message to the participants. Apparently, we lost the connection with Dr. Sand. So there are two possibilities. One is that we jump to the next presenter, and that is what I would suggest to do. And then we can come back to Dr. Sand's presentation later. But in the meantime, I'll take this opportunity to ask you really to put your questions, if you have any, and your comments in the Q&A section as we go along, because, you know, it's we will collect them and then answer at the end. So with that, I will hand over to Tony Smith.
Good morning. Good morning, everybody. Thanks, Maged, for passing me over. Thanks to the previous speakers for setting the scene. So as Maria mentioned at the beginning, the communication section of the guidance is something completely new. We've developed various social science techniques and approaches at EFSA in recent years to try and address some communications issues, and since communication was recognized by the Commission and national partners as being particularly challenging when it came to risk-benefit outcomes, communicating those to their citizens, we felt that this was an important development. Just to mention that I'm speaking on behalf of EFSA's Working Group on Social Research Methods and Advice. So next slide, please. So yeah, just to reiterate that this, in the terms of reference of the guidance, we aim to use social science insights to communicate risk-benefit assessment outcomes and dietary advice to the public. So we do an overview of the literature, looking at things like understanding, awareness, perception, behaviour. We did this through some systematic reviews, and also we included papers identified by experts in our working group. Next. So really, what we were asked to do was to provide some advice and also identify tools that could be used by communicators working for assessment bodies and potentially also by decision makers, so risk managers, risk benefit managers in this context. When should these tools and advice be used? Well, already considered at the beginning of the process when framing requests for risk benefit assessments, just to contextualize the human health question within the broader social, cultural, and even environmental context. And then at the end, or at the successive stages, when the risk-benefit assessment outcomes are available, and whenever risk-benefit management measures might be communicated to the public. Next slide, please. So this is just a quick overview of the evidence that we used. EFSA outsourced some work to do a systematic review, which is the paper there on the left. And we filled additional gaps through an ongoing project. We had the second paper. We also looked at published reviews and specific articles as mentioned. And then the tools that we included, we basically adapted, modified existing tools that EFSA uses in its own communication planning processes. Those are described in the fourth paper there, Societal Insights in Risk Communication Planning, a Structured Approach. So we adapted the tools that are mentioned and described in some detail in that paper. Next slide, please. So what did the literature say? Well, we looked at the literature in three broad aspects, so consumer perceptions related to food risks and benefits. So what we saw was that perceptions don't necessarily influence behavior. Other factors are also important, like trust in the source, the knowledge level, some confusion about the information that's given. Risks and benefits can be both dependent of one another and completely independent of each other in the perceptions of individuals. Individuals make risk-benefit trade-offs when they decide about their food choice, when they make food choices, but they weigh up many different factors, and not just necessarily the human health ones that we might want them to consider. There's no agreement in the literature on the relative weights of health risks and benefits, also with non-health related risks and benefits. And sometimes these can be more important in trade-off decisions. This comes through in some of the studies. Information seeking and processing, that's very important for communication. So what we see is that generally there's interest in food safety, but people tend to be passive, so they don't necessarily go looking for the information. They more soak it up as it's kind of spread throughout their daily lives. Trusted sources, so vary a great deal by country and age group. And generally risks are prioritized over benefits when information is lacking or contradictory. So those are just some of the, let's say, key findings. There are others, but those are just some worth flagging. Next slide, please. This is just to show you, let's say, how we structured the different elements that we provided. So the first two blocks here, problem formulation and risk-benefit assessment, we have two tools that we use at EFSA that we've adapted. So if you click, you'll see that during the pre-assessment, we already kind of try to characterize a little bit the risk and the benefits for humans, so for human health, but also those others that could be important for citizens, such as environmental aspects or socio-economic aspects. Those are not included in the risk-benefit assessment, just to stress that, but they're important to contextualize how citizens process this information and make decisions, food choices. So the knowledge awareness and whether or not there might be institutional or stakeholder interests. If you click, just to show that, this adapted tool that we use that we call the communications checklist, we've made available on Zenodo, which is an open access data sharing platform. It's open to anybody. So we made this checklist available there so it can be tested, and we'll be testing it ourselves when we get an opportunity in the near future. Then during the risk benefit assessment, we can also do a concern assessment, which is a more in-depth look, looking at more social insights. We do a review of some important literature on a topic. We do social listening, etc. And through this, we do have a better understanding of the audience and the information sources and best practices, and then we come up with some strategies and tools. So this is a more in-depth look, whereas in the previous one, it was more a screening element. So those are the two tools that we've included in the communications part. If you click, then really the second part is really the advice. So giving the advice to communicators when they need to communicate the output by the assessors, so the risk benefit assessment outcome, and who they would need to communicate to, managers, to stakeholders, to the public. And then at the second step, this is more to support the work of the risk benefit managers, the decision makers, when they need to give advice to consumers, such as dietary recommendations. So if you click, you'll see that this is more about supporting managers, mainly in national authorities, but also at European level. Next slide, please. This is just a quick slide just to show you quickly those tools that I mentioned on Zenodo. So there's a page. You can, if you click through these, you'll see that we have, the first one there, that's this checklist, which we've modified. There's a decision tree there, also modified. The concern assessment framework, these has tables listing. No, if you can go back, please, thank you. So in the concern assessment framework, we have tables which list the various different areas which are critical to really understand better the perceptions, both about the risks and the benefits, and whether those are social, cultural, individual traits, or if they also could be linked to the information that's used. So those tools are available there. Anybody can use them for their own work. We will be using them as well when we get the opportunity in the near future. So next slide, please. So the advice, if you like, so it's mainly aimed at communicators at scientific advisory bodies like EFSA, where we do risk benefit assessment, or mainly risk assessment, but we'll do risk benefit assessments as well. But it's also useful for communication of management decisions and actions, and we hope at least that it's useful support for our colleagues in the national authorities and at the Commission. If you click. So the advice that we give, very simplified form here, is just that a concrete mapping of the risk benefit of the factors that influence risk benefit perceptions need to be prepared before, or let's say in the preparation towards communication on any of these topics. This includes both the health related and the non-health related, so things like environmental aspects or ethical issues that might be associated with a certain risk benefit context. But communication should try to address a limited number of these factors. So communication should not try to cover all the different factors, but really focus on the most critical ones for the different audiences. Click, please. Information needs should be clear and concise. That goes for anything really, but just to underline that it becomes critically important when you want people to start weighing up and balancing and making choices between two different choices. As well as information about knowledge, so knowledge about the specific health factors, people's values and attitudes should also be addressed. So communication should not just focus on increasing knowledge, but it should also address the fact that values and attitudes are being recognized and not neglected in a specific context. If people have pre-existing beliefs, for example, then special strategies might be needed, because we know that it's very hard to try to change people's understanding of a topic if they have pre-existing beliefs. So there might be special strategies needed there. Okay, next click, please. So also, once we have the factors, then for each of these specific trade-offs, we need to try and characterize them. So they could be a trade-off between health and hedonism. So I like something, it tastes good or whatever. It could be economic versus the characteristics of the food, it's tasty or it's healthy. So these trade-offs, these couples of trade-offs can be done for each particular situation, and that can help the communicator with their messaging. There are multiple trade-offs possible, and they can lead to negative choices for health. So this is quite normal. People make choices all the time, which might not necessarily be the best for their health, but targeted information can help in those cases. Next slide, please. So just to quick overview, we have some ongoing work at EFSA where we're trying to encourage research on the topic of risk-benefit trade-offs made by consumers in relation to food, and we hope to be promoting that from later this year. In 2025, there's a scientific report on fish and seafood consumption and awareness of advice on mercury as a contaminant in fish and seafood. And that includes, if you like, some aspects of risks and benefit awareness among the target population that we've looked at in that report. That will be coming out next year. And then in the slightly more distant future will also be obviously the risk-benefit assessment, which was mentioned by Maria earlier. We'll need to support that with communication. So thank you very much, and I'll pass back to the chair or to Salomon if he's back with us.
So, hello, do you hear me? That's like this.
Yes.
So, okay, thank you. So if we can, I will then present about the additions, method additions. I see that the slide is kind of frozen here now also.
Okay, it seems that we are having real issues with the connection, Dr. Sand. So it's a very specific area of his research, so it would be actually very, very shameful if one of us would take over from him. But I'm just wondering if Morten, do you feel competent or confident enough to talk about that, or should I give it a try?
Yeah, well, I think it could be difficult to give his presentation as such. We could also, I don't know whether we should go to the questions, have a question in between or something like that, to wait for him.
Yeah, because it would be a shame if he cannot present himself, you know. So why don't we do that? Let's maybe just start with a few questions and answers. I'm very sorry about this unforeseen issue that came up, but it's you know, nothing's lost. We will manage to get the presentation from Salomon Sand before the end of this information session. In the meantime, let me just, there have been a few questions that came up. Some were really relatively general, but I think it's more, you know, for EFSA, for Maria, and maybe for myself. So the first question is really, can we envisage RBA for a regulated substance or product like food fortification supplements, disinfectants, and the like? And linked to it, there is also a question about outside of common contaminants or nutrients, can EFSA provide another example of a substance that would be considered in an RBA consistent with the terms of reference? So let us take those questions together. Maria, I'll hand over to you to start, and I'm happy to complement afterwards, please.
Thank you, Margit, and thank you for the questions to the audience. So I'll try to answer this. Whether we envisage RBAs for regulated products or substances, such as food fortification supplements, etc. So for EFSA, we get mandates from the European Commission to prepare opinions. So currently in the regulated products area, consideration of the benefit is not a requirement. I would also probably reiterate that an RBA is not to replace existing legislation. So where the safety of a substance is a priority, then that is not replaced by another assessment. So it also may apply, for example, to disinfectants, in which case we may have a risk assessment. So it is a risk trade-off in that case. So some substances may be naturally present in the environment, not necessarily contaminants, that could also be subject to an RBA. But when it comes to regulated products, we have to be mindful of existing legislation and a legislation framework that cannot be bypassed.
Yeah. Indeed. Thank you very much, Maria. One should also note that, for example, for the additives, if an additive has a, what you'll be doing is you'll be looking at, let's say, for nutrients, you'll be looking at the risks and benefits of the same compound. So it is a normal assessment of the, we'll be developing the DRBs for both sides, the excess and the low side of the curve. So it's not a classical risk-benefit assessment. And as Maria has said, for example, if you look at the chlorination of water, the chlorination or the treatment of chlorine of some food, we're actually avoiding one risk, but we may be creating a new risk, a chemical risk. We're avoiding microbiological contamination by maybe creating another risk. So the assessment will be a little bit different. It's not the same as a classical risk-benefit assessment, although we can call it risk-benefit indeed. So it's not subject of this risk-benefit assessment guidance indeed, but certainly these questions may occur. And concerning the examples that we can provide, there are no examples currently in EFSA, and there are no mandates expected for any other compounds apart from contaminants indeed. So with that, let me then move on to the next question. We're still waiting for Dr. Sand to reconnect. I think he's about to join us. It was just admitted. So let's see if he can join now, then we can continue and get back to the question and answer session at the end. Salman, can you hear us? Okay.
Yes, yeah, I hear you.
Brilliant. Okay, so we will then go back to Dr. Sand's presentation, and we'll come back to the Q&As afterwards. Please, Salman, go ahead.
I turn off the camera. So good morning, everyone. My name is Salman. So I will speak a little bit, add to what Morten talked about in the beginning. I will cover characterization and integration of risks and benefit using other methods. So cover the other methods that we also bring up in the guidance. So you can change the slide. So basically, this is a kind of a summary slide. I'd like to highlight as well that we have, there's a table in the guidance, table 3, that kind of provides an overview of all the different approaches. And summarizing this a little bit, we cover a bit of ranking approaches and also this kind of more common approach for comparing exposure to health-based guidance values or dietary reference values. This is obviously also part of the previous guidance. You can perhaps say that we have slightly extended that a little bit. On top of this, we also cover methods for assessment of multiple effects, a little bit about the decision analysis, and then also, I think, as perhaps Maria noted in the beginning, we have a kind of a subsection in the integration part of the guidance that discusses a little bit about this with the issue with weighting of effects. So this kind of thing, I will mention a few words also there, but that kind of concerns aspects relating to several of the different approaches. You can change the slide. So we give some examples of ranking approaches that could be used for initial prioritization of food components. In a situation when you have a kind of do a broad assessment, you perhaps would like to narrow this down a little bit and focus in the end on the more important risks and benefits. So as one example, we cover a score-based ranking approach that considers occurrence. In this case, this means kind of the significance or significance of exposure and also severity of the health effect involved. And this approach is kind of a broad approach. It kind of performs across the different domains, the toxicological, nutritional, also microbiological domains. So it's kind of broad in that sense. We also give an example of a more of exposure-based ranking approach called a risk thermometer that considers health guidance values, exposure, and also accounts for the severity of effect, of the health effect. So far, this approach has only been used for ranking of chemical hazards, so it's been kind of used to prioritize in that domain, you can say. So these are two examples that we give for initial prioritization of food components. So you can change the slide. Then going into the RBA, we of course cover this approach of using HGBVs and DRVs, and this can be done, of course, in a simple way, just using existing values like that and compare that also with rough estimates of exposure, for example. That kind of level of detail in such an assessment would kind of resemble a little bit what goes into these ranking approaches just talked about. They're also kind of a little bit rougher. But you could also, this type of approach, you can also, of course, refine by accounting for variability and also uncertainty in both sides of the coin, both in the exposure as well as the health-based guidance value, or DRVs. So you kind of approach a more probabilistic assessment of how the exposure is in relation to these reference values. And this kind of part, I guess, is also covered before in different documents and also in the previous part of the previous guidance. What we do kind of note also here is that you could potentially make these HGBVs and DRVs more comparable if they're defined by in terms of biologically based benchmark responses. In the case if they are derived using dose response modeling approaches like the benchmark dose approach, you could, I mean, the benchmark dose is the dose that corresponds to a certain level of response in a particular endpoint. This kind of is the starting point for that after application of assessment factors becomes a HGBV. If you define this BMD as corresponding to some level of response in the endpoint that is kind of biologically relevant or significant, and you have different type of HGBVs here and DRVs and different effects they are based on, and you calibrate these responses so they are for each endpoint, biologically relevant, that could, basically make these reference values somewhat more comparative. So that can kind of make an assessment like this more comparative. It could be a practical challenge to do that, but we also wanted to note this is this aligns this also a little bit with other guidances. For example, the EFSA guidance on the benchmark dose states that you should try to define the benchmark dose in this way, at least if you have a continuous health effect. And this is also, I think, in line with the recommendations from the WHO on dose response modeling. So there are different kind of advancements you can do here, kind of a basic assessment, the kind of variability, uncertainty, and potentially also make these HGBVs and DRVs more comparative by using these more biological based responses in their definition. I also want to point out that this issue with advancing the assessment by accounting for variability and or uncertainty, I guess this applies to all the different approaches. It's not just for this type of approach. That could be used as a form of advancement for other approaches we cover here as well. So you can change the slide. We also discuss about the methods for assessment of multiple effects. Specifically, we mentioned categorical regression and also methods that I've been part of developing myself, that is also illustrated here to the right. And these type of approaches include, you can say, a severity scoring system that places various health effects on a common scale. This is exemplified by the y-axis, you can say, in the figure there. So you have there something, you have different categories, C1, 2, 3, 4, up to C9, and you know, you would classify more severe effects higher up, in this example, cancer or liver cancer, and lower down in the system you have liver enlargement. So this is a kind of a increasing level of severity. And these kind of approaches has been proposed and used, applied for chemical hazards, developed for such kind of for that domain, so to speak, but we think they also could help in RBA due to the standardization that results from this severity scoring or categorization. And you can change the slide. So as an example here, these type of approaches allows you to, for a given exposure, estimate the probability of a given severity category, one of these categories, or all of them. So this is one type of outcome. Also, in this particular approach that is illustrated, there is also a weight function attached to that approach that can help to perform effect or integration of these categories. So you can derive a form of weighted average of the probability of effect, for example, or a weighted average of the result in these different categories. So the blue areas you see in this figure, that would be kind of the probability of the different categories along the y-axis, and you could also kind of aggregate them together in terms of, for example, a weighted average. So this becomes a form of, in that sense, alternative composite type of metric. And then, you know, it remains to be seen, I guess, if you could also fit benefits in a model like this, but nevertheless, you could derive, you know, benefits separately. So, for example, a reduction in disease incidence, if you look upon that as a benefit, that you can then try to map that in the same system, C1 to C9 in this case, and then you can compare that reduction in these disease incidence to the risk result for that same severity category, for example. Or you could also weight this disease incidence. If it's disease, it would probably rank a little bit higher up in this system, and you can also attach a weight between 0 and 1 to that, and then compare that to the integrated or weighted risk result. That's another example. So even if you calculate kind of benefits outside this system, you can try to map them in the system and get some form of this approach, some form of quantitative comparison. And we have an appendix in the guidance that describes a little bit more in detail about this. You can change the slide. We also briefly speak about the probabilistic decision analysis. I mean, an option is also, instead of combining information like just described, you can make use of estimated probability of effect, for example, separately for all the risks and benefits. And you can then, of course, look at that from a purely qualitative point of view and come to an overall conclusion. And another option besides what has been mentioned is also to do some form of make use of multi-criteria decision analysis or similar in order to kind of arrive to an overall conclusion. This can be an approach as such, but we also kind of wanted to extend the options here. I mean, in some cases, perhaps we would like an alternative to derive a traditional composite metrics or do some combined analysis. As I just discussed, perhaps this can be, in some cases, complicated or not straightforward. So you can also have this type of option. You can change the slide. So finally, I will make some remarks on this issue with weighting of health effects as well. I mean, this I think is a fundamental challenge in RBA, the need to balance different type of health effects. And as I mean, the WHO disability weights used as part of the DALI calculations are obviously the most established kind of factors. That's also weights that are on a scale between 0 and 1, and they exist for a number of health effects. Generally different diseases, but some other type of effects as well, but typically different diseases. There are schemes also as part of other approaches presented in the guidance, for example, what I just showed you for the multiple effect approaches. And we think that these type of schemes could also potentially, well, besides their use, the use within their actual methods they belong to, they could perhaps also support other approaches with kind of schemes or inspire how you could think around this issue. When it comes to these newer schemes, however, we also think that the selection of weights in those schemes should be performed in consultation with risk managers. So yes, I think that concludes my presentation. So thank you.
Yeah, thank you very much, Solomon. And I'm happy you managed in the end to still give us the full presentation, because I mean it's a highly technical, it's a very important part of this guidance indeed. So with that, let's move back to the Q&A session that we had started in between. And maybe I'll just start with a question, which is pretty interesting. It says, if pursuing a real risk-benefit assessment, the old paradigm of it is not safe, it is not food, is outdated. Are EFSA and the risk managers already prepared to step away from a full safety assessment towards more optimal food and nutrition? And is the general public ready? This is, of course, a very philosophical and maybe a bit provocative question, but I think it's an important one. So can I hand over to Tony, please? Are you willing to take over this one?
Sure, thanks, Maged. Well, I think importantly, what we should stress is EFSA's role in food safety, and this question goes way beyond EFSA's role. We don't really, this is a political decision about what you want the food safety to represent, and so of course that's outside our responsibility and remit. So I would say whether or not we should do that, that's not EFSA's role to say so. As to whether or not the general public would be ready for a different kind of philosophy, let's say, for food safety assessment, we've heard already calls in Europe, let's say from some, to put quality more into the picture. Again, we don't have a strict we don't have a position on that. That's for society and the politicians they elect to decide. What we can say in terms of general public, and we see this from the surveys that we do, is that already people take into account many things when they make food choices. Food safety is just one of them. And health, nutrition and health is another aspect as well, but they're not necessarily taken into account to the same extent, or even traded off in the same situation. So for some foods, health might be important, for others, food safety might be more important. And there are several other factors, taste, obviously, but cost as well, and things like convenience, and even some ethical aspects like fair trade, etc., that people take into account all the time. And so whether or not the general public is ready, again, I would say also we can't generalize. So some people maybe would accept a move in this direction, others would absolutely not. But it also depends on the food that you're talking about, and all those factors that were just mentioned. Thanks.
Yeah. Thank you, Tony. Thanks very much for this response. I think, as I said, it's really a very philosophical issue, and we cannot. It's not another regulatory nor a scientific kind of decision that can, or answer that can be given here. But I think you're absolutely correct. Let's then take another question, which is, again, I think most of the question addressed regulatory aspects. So this one has two aspects to it. It was noted in the draft guidance that the risk benefit manager concludes whether the outcome is adequate to make a decision. How will this decision be made? Can we anticipate corresponding legislation on application and use of RBA for risk management decisions at the Commission level? So one part of it is a scientific question whether when is an assessment, RBA assessment, done sufficient? Who takes the decision? What comes from the science? What the risk assessment? What comes from the management? And then the other one is a regulatory one. So maybe I'll ask Morten if you can answer the first one, the first part. One is an assessment from the point of view of the risk-benefit assessor done. What are the criteria?
Yeah, thank you. I think it's very dependent on the risk-benefit question. If the risk-benefit question says that they would ask an answer in a qualitatively way, then it could be okay to say you can identify whether the answer is something like this is better than something else. Otherwise, if the risk-benefit question asks for a quantitative assessment, then you should the answer be something like how much better is this compared to something else. So I think it's very much depending on the risk-benefit question. This. Yes, and I don't know whether the regulatory part. Will you take that, Majid?
Yeah, I can pass it on to Maria, or I can take it. Maria, would you like to take it, or should I take it? It's.
Yes, I can take it. So I agree that this is a decision that needs to be taken in conjunction with the risk manager. EFSA will work closely with the risk manager, which is typically the requester of the mandate for a risk-benefit assessment, and it really depends on the needs. So it depends on what question the risk manager really wants to answer. So as long as there is an answer that serves the needs, I think the assessment can conclude. If that is not sufficient, then potentially additional data would be needed, and the assessment can continue to higher levels and higher refinements. In addition, there may be also other elements, other aspects that need to be taken into account, such as alternative diets, etc. So it is a decision that has to be taken together with a risk manager.
Yeah. Thank you very much, Maria. There are a couple of questions that are more of general interest. For example, can a member state request an RBA to be performed? And how is this decision made? And is it tasked to EFSA to perform, or the member state specific agency? Well, it's again, it's a question that is really for EFSA. I'm happy to take it for now. Of course, EFSA gets tasked by member states or by the Commission. So member states are certainly free to ask EFSA to conduct an RBA, of course, as they do for risk assessment. But generally, there would be, of course, a wish of EFSA to collaborate with the member states that has requested this assessment. And the aim of the guidance is really to enable everybody to be able to do the risk-benefit assessment. So the agencies should, based on the guidance, conduct their own risk-benefit assessment. And if there is a need for EFSA to help or to collaborate, or for EFSA to conduct the assessment, then certainly it's within the mandate of EFSA to assist or to conduct the risk assessment, the risk-benefit assessment indeed. I don't know if Maria or Tony would like to add here. It doesn't seem to be the case. Tony? No? Okay, brilliant. So here is one question that is also interesting. If an RBA is not requested by a member state regulatory body, but it has been performed, say, in the academic field, which we see more and more, in fact, how can it be elevated to the interest of the risk managers or the risk assessed? So the question is really to, I would say, to those who are conducting risk-benefit assessment. So Morten and Salomon, Can I ask you, because you've certainly, I mean, you are in regulatory agencies, but you certainly also conduct others and know of other assessments that have been conducted outside of the regulatory field. So first Morten, and then maybe Solomon can add.
Yeah, first of all, I'm not in a regulatory authority, just to say it, but it's okay. I would say that if you do it on your own initiative, which we also have done, it can be, and for example, a university that takes the initiative to perform a risk-benefit assessment, and it's not involving the risk, the authorities. Then you will have this published, and it's also very much depending on how close you are to the food authorities. So you can also send them a note about this and to make them interested in this area, to see whether they would like to take it on board and also use it as a part of when they are performing their food with the dietary guidance, for example. This could be used for this. So. But otherwise, it should be published in peer-reviewed papers, published in popular magazines, and also inform the food authorities about this.
Yeah, thank you, Morten. I wonder, Solomon, would you like to add here? I think it was a very comprehensive answer.
Yeah, I can just say a few words, if you
please. Yeah.
So yes, I kind of agree with what Morten said. I mean, I work at this food agency. Sometimes we are tasked with, a few times at least, we've been tasked with doing a risk-benefit assessment based on, tasked by our managers. But I guess if something that was conducted at university and so on, I think that would be something that we would consider as part of the work if it relates to some of the work with dietary advice that is conducted. So yeah, as we would normally do for other type of things that appear in the scientific literature.
Thank you, Solomon. And I may hand over to Maria because she might have some additional issues points to bring up here in this context. Maria, please.
Yes, thank you, Maggot, and thank you for the question. Indeed, when we were in the process of drafting this document, this draft updated guidance, we realized that there are a lot of publications in the literature that are RBAs of different foods, and a lot of them are on fish, for example, etc. So yes, we are aware that there a lot of activity is happening at academic level and in research environments that could provide very useful information to EFSA for an EFSA assessment. We have to say that in order to take this into account, we will need to have some kind of mandate. So EFSA will either it's an ongoing assessment that EFSA is performing, in which case all the relevant literature will be taken into account and included into the consideration of the evidence for that assessment that is ongoing at the time. However, if it is on a subject for which there is not an ongoing assessment, perhaps this new document, this new assessment published in the literature could get the attention of the Commission, who in turn can ask EFSA to revise an existing opinion or to update a document to take into account this new evidence. So we'll definitely be more than happy to incorporate assessments that have been done. We recognize that they are complex and they take a lot of work, so no work will be left unused, and when relevant, it will be possible to incorporate it within EFSA's assessment and also under the regulatory framework in which we operate. Thank you.
Yeah. Thank you, Maria. Thank you very much. I'm afraid I have another question for you, which is the following. In determining the health effect of eating less of a food, will the food replacing that food in the diet be taken into account? I think the issue is really a kind of a scenario of a replacement of a diet by another. So what will be, what is the approach there? Please, Maria, again. Sorry, you seem to be very popular.
Okay, yes, thank you very much. I'll take this question as well. Indeed, if one looks into the literature, there are examples where a risk-benefit assessment is conducted for a specific food, and whether the conclusion is that the benefits outweigh the risks or vice versa, this is only part of the answer. There are assessments that include a reference scenario and an alternative scenario. In this case, there are two food consumption scenarios compared, and the risks and benefits are assessed for both, and then the outcome is compared. That is also part of the story. It is in cases of replacement of a food. So if one eats less food, then one needs to look at what are the available alternative options to the population or to the individuals. There are subgroups of people who may choose a certain diet, eating less foods, etc. So, but this, needless to say, it complicates the RBA quite a lot, because the alternative diets may not be the same for individuals even in the same country. So different alternative diets could be considered. It is part of the RBA to do so. It's just it would make the RBA more complex.
Yeah, thank you very much, Maria. Thank you indeed. Some of the questions overlap, but I think it's important. I think it's still important to mention those questions that came here. For example, a very specific question: is EFSA planning to apply RBA to novel foods and cultured meat? So here I would like to maybe give the floor to Tony. And then I might add something here. Please, Tony.
Thanks, Margaret. Well, I suppose the short answer is no. Novel food regulation, which governs the whole novel food process, only anticipates a safety assessment by EFSA, risk assessment. So it's not within our remit to look at the benefits. That's for risk managers to consider. Maybe just another point is that EFSA hasn't received any dossiers for cell culture derived foods, including meats. So no such assessments are currently planned, because we haven't received any applications. It's worth pointing out maybe that there are some academic research projects doing that kind of work. A useful one actually that we're familiar with was an EFSA funded project, NOV RBA, Novel Foods as Red Meat Replacers. So that gives some insights into risk benefit assessment methods that could be used in the novel foods area. So feel free to look that up. It's an interesting research. Thank you.
Thank you, Tony. Thank you very much, Tony, indeed. So let us take another question that goes into the same direction. How is EFSA considering the use of RBAs in their assessments? Based on current guidance, it does not appear that benefits are typically considered in the safety assessments. And here, let me just answer quickly. It's relatively clear that, as Maria has mentioned in her part, the idea a risk-benefit assessment does not replace or does not change the regulatory framework for the risk assessment of individual compounds, or the benefit assessment of individual compounds. So it is really, the aim is for the risk-benefit assessment to be done when a risk-benefit assessment is needed. That nothing will change in terms of a risk assessment or a benefit assessment as such. So in the end, the regulatory frameworks remain in place. I don't know if Maria, you'd like to add here, or Tony, Maria?
Yes, I can respond if I get the screen. Okay. Yes, thank you, Margit. Indeed, I second what you just said. I confirm. Maybe to emphasize that especially for substances added to food, the priority is to demonstrate safety. So this falls under specific regulatory frameworks for food additives, substances with flavoring properties, etc., or other regulatory frameworks. So the priority is to show safety. The RBA does not replace the demonstration of safety. Thank you.
Yeah. Okay, thank you very much, Maria. Let me take a technical question now. And I hope that Solomon can hear me. In what way shall we take into account inter-individual differences? This can mean that we will have to accept that risk and benefit curves will overlap, because risk will never be zero. Well, risk will never be zero anyway, but Solomon, I don't know if you would like to take on this question.
Yes, sure. Do you hear me? Or
yes, please.
Yes. Well. I do believe that I mean there are approaches for accounting for variability and also uncertainty, as I briefly mentioned about. So I think that you can account for that, if I understand this question correctly, and that can kind of and of course you can that to a higher extent get the form of overlap situation, but still depending on the type of metric you have, this can be more or less comparative, and you can see what type of exposure scenario or change in exposure scenario, also accounting for this individual variability, will if the risk will overall then be significant in relation to the benefit or not. So I think the approaches available, if you account for population variability, could kind of address this.
Yeah. Okay. Thank you very much, Solomon, for this. Thanks a lot. Well, we're not getting many questions anymore. We're not getting we're hardly getting any. So let me just maybe ask Tony, because I think in other areas there have been more detailed guidances on communications. So why is the communication part, so condensed and so short? Are there any plans to enhance that kind of work? Can I hand over to you, Tony?
Sure. Thanks, Margit. Well, yeah, it's true. And we ourselves, EFSA, we've produced handbooks, guidebooks, if you like, on risk communication. We have crisis communication guidelines, which obviously are critical for use in particular situations where there's a food incident, food safety incident, or an outbreak, or worse, an emergency. So we produce those types of things. I guess what we've already heard a little bit during the whole info session is that risk benefit assessment is quite a niche part of EFSA's work. Doesn't make it any less important, but it's quite a niche area, which only a few risk benefit assessments have been done. And even in the near future, we're not expecting a flood of new requests from the Commission of Member States. Of course, it could happen, but so what we wanted to do here was just have a short but very focused a section, which really it isn't telling communicators how to communicate, because it's just too complex to try and address all those different aspects. What we provide are some basic tools adapted for risk-benefit contexts, and some basic advice to take into account, but then all the legwork needs to be done depending on the specific risk-benefit question and all the different factors that could come into account. it would be a huge work to try and address all of those in a single document. And the last thing we wanted was to turn the scientific committee guidance into a a kind of how to do in detail of risk benefit communication.
Yeah.
Thanks.
Yeah. Yeah, thank you very much indeed, Tony. And I think really risk communication is gaining more and more importance. So I think it's really good to know that there are certainly efforts that will be underway to address this issue in more detail indeed. Okay, we have one so far final question. Are there any useful repositories online where RBA methods are transparently communicated? For example, via R or Python. So maybe I will again, I'll put you on the spot, Morten, and then Solomon. Please, Morten, if you know of any repository that exists.
Yeah, I know of some repository that exist, but I'm not quite sure whether they are public. Actually, so I'm a little bit reluctant about this. I think there's several institutes, they have their own repository about these methods. But then I think I will pass it over to Solomon.
Yeah.
Yes, sure. Well, I mean, you have, for example, when it comes to these approaches that I talked about regarding multiple effects, you have the US EPA, I think it is, yes, they have the categorical regression software. So this is something I think you probably can download, go to their homepage and download. So that's an example. When it comes to other approaches that I also mentioned there is some plans we have to try to make the applications we have available, hopefully during this year. So this covers the approaches that I talked about regarding multiple effects. This is at least an ambition. So that other multiple effect approach doesn't currently exist in an easy format for unless you implement it yourself. But we have plans to release the application for that. Yeah, I guess you have also, well, partly, I mean, you have software for dose response modeling and so on by EFSA, for example, that could help in the process. So that's one example as well that kind of partly supports this kind of effort.
Yeah. Thank you very much, Solomon. And in fact, this concludes the questions that we have so far. So I wonder if there are any questions that the audience may have. If not, and I don't see any new questions coming in, then my suggestion is that we close the session for today. If you all agree. Thank you very, very much for your participation. Indeed, it's been an interesting session in terms of the questions we received. But please remember that we need your input in addition to what we got from you today within the framework of the ongoing public consultation. So please do engage with us and do provide your comments on the guidance, because it's really important that we have as much feedback as we can get in order to have a useful document that comes out of it. Just to remind everybody that the recording of today of the event will be available on the EFSA website within a few days. And then finally, that after we close the meeting, you will receive an evaluation survey, and we would really ask all participants to take the time to fill it out, and your feedback would be essential certainly for future events of EFSA. And with that, let me thank you again for your participation. Let me thank my colleagues for their excellent presentations and their responses to the questions. And yeah, we're waiting for your input for the further improvement of the document. Thank you all very much, and goodbye.